So for this particular investigation, it was conducted in Victoria. So our participants are reflective of the population here. It's a pretty homogenous group. It's overwhelmingly white and middle to upper middle class. So you have a very particular social location. And so that is not, reflective of other groups of men. So we need investigations with more diverse groups in terms of race and socioeconomic status and even location. Looking at urban versus rural, so looking at smaller towns and what men's experiences are there, as opposed to being in, Victoria isn't a massive epicenter by any stretch of the imagination, but we have a lot of folks that were needing to go to Vancouver for treatments and for health services. So just interesting looking at how that works in terms of what resources are available and bringing our attention to the fact that, hey, like, people shouldn't be having to travel to Vancouver for things. Like that's costly and not particularly practical. So certainly looking at that, and also I think the geographical location was a big one that we were just really interested in, looking at rural and looking at men's experiences in rural settings. But certainly in terms of the sample, so we need a more diverse, we need to understand other socioeconomic status, like other social locations and geographic locations, even the intersections of those. I really want to express my gratitude to the men that took part in the study for taking the time to meet with me to talk about their experiences, which were often not easy things to talk about. And I was just really happy that we were able to establish a level of trust where they felt comfortable sharing their experiences and knowing that was going to be used for benefit, right? So we're taking this information and we want to put it towards developing more meaningful and effective health resources, and to informing and educating health professionals how to engage meaningfully and effectively. That's the focus of this work, because it's so important to have the input from representatives of the group that you're hoping to benefit, to weigh in and say, hey, yeah, you know what, this sounds okay, but okay, what we might want to do here, or like, what language works for you? Like, how can I do this in a way that's going to be appropriate? I need that guidance. And I just think that's so important in our world today, as we look at there's so much happening right now, and just recognizing and appreciating, working together and learning from those who our work is meant to benefit. I just really appreciated that guidance and input and support from the advisory to ensure that this work was appropriate. Based on my clinical background and the work that I've done, the third paper for my dissertation focused specifically on mental health promotion. And so what are men doing to promote there? Because in conversations overarchingly in the data, like when we talk about health, like men would talk about emotional well-being. Like when they would talk about health, I have this whole conversation about how we conceptualize health. There isn't this like physical and mental, it's this entire like conglomerate where emotional well-being is really, really important. And that paper talks about how men came to that conclusion. But from the participants, and I know that this is a really developing area looking at mental health and mental well-being, and I'm so happy because we're really working to address that stigma and understand, like, how can we support one another? It's such an important, this is our health, right? Can't think of it in this very divisive way. So a pandemic just layers some real complexity into, create some huge obstacles for emotional well-being for anybody, because I know from that third paper, one of the key protective or those processes that was really meaningful and effective for emotional well-being was being connected with your social group and having people to talk to and being able to express how you were feeling. And that was really, really facilitative. And men were actually really open about talking about their feelings. They had come to recognize, like, hey, this is really helpful. When I sit and I talk to somebody about what's going on, I feel better. And there were certainly other things that came out of that paper, but that was a big one. And that's not surprising, right? That social connection. Whether that was through a specific resource that was recommended by a health professional, or whether that was within their own circle, being connected. So COVID presents a huge barrier to that, because we can't get together in the way that we used to and derive that benefit. So, we have encouraged people to, to go online and to meet with, your circles online, and some resources are being offered. Some of the groups and other health supports can be done through technology, but arguably it isn't the same. So it really just, it really confounds those feelings that people might already be experiencing, right? That they're already navigating. And now you layer in a pandemic and we can't draw on those options that we have for feeling better, getting together, talking. So I just think finding ways, and when we did a webinar for BC Campus about what are students doing, we did a webinar for LGBTQ2S+, and understanding that was the biggest thing. All of our Pride events are canceled. Like, we aren't able to get together in our supportive environments in a way that we're used to. So finding creative ways to get together online was hugely facilitative. But I think that was actually something that came up a lot, was the challenges in connecting with your care provider, right? Not being able to meet with your care provider and talk to them in the usual way. I think things have calmed down a little bit. So we're going to be shifting into, we're actually able to go and see your primary care provider. But having a good relationship with your GP or your nurse practitioner, that was huge from our paper. So having that, and a lot of people don't have that, or they don't have somebody consistent. They just go to a walk-in. So that piece is huge, because that then connects you to potential other resources that are helpful. But during the pandemic, it was really hard. You could do like a Zoom interview with your primary care provider, and so, but it's hard to talk about some of those really intensively emotional experiences through Zoom. It's not the same as in a clinical setting where you're able to talk, person to person. And if you have that good relationship, your care provider can really facilitate working through, all right, here's some options, and this is what I'm hearing, this is what I'm thinking, and then making those connections. Mm-hmm. But I think now with, and I know it's not the case across the country, but with things opening up a little bit, and with the weather, the summer weather, I know that there are, as we know, that physical activity is so helpful for your emotional state, that there are options where there's like yoga groups being offered in parks, like things that are being offered in outdoor spaces, I think might be a really great option for a lot of people who are feeling these things, to get out, get connected in a socially distanced and appropriate way, do something physically active, or get together with your circle, whether that's your health resource. If you're part of a group, maybe you can do that outdoors. Maybe you can meet your friends that you regularly derive support from, outside, 2 meters apart, to at least talk. I think that's really, really important. Finding the way to socially connect during this, I think, is the most important thing for people to be doing for their mental and their emotional wellness.